Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Dr. Godey, what is a caregiver?
Well, it's interesting you should ask that question because when I try to talk to families about being a caregiver and caregiver stress and those sorts of issues, they will tell me, "Oh, but I'm not a caregiver. All I do is the laundry. I get her medications. I take her meals over. I go with her to doctor's
I
appointments.
make the doctor's appointments, I fill the pill boxes."
But that's not a caregiver. A caregiver is someone who has to bathe and dress the person, move them around in bed, transfer them to a wheelchair.
So, wait a second. You're saying that the common misperception is that you're not a caregiver unless you're doing those hands-on activities of changing, moving, making the bed, that sort of thing.
Exactly right. That's the kind of comment that I get back. I'm not a caregiver because I don't do those things. And it's really difficult to get families to accept that yes, they are doing caregiving tasks. They are caregivers.
Well, and it's important because we've talked about caregiver stress. It's a huge issue. Just having your phone on 24 hours a day, not knowing when the 2 a.m. call is going to come, either from your loved one who has awakened and is lost in the facility, or that there's a medical emergency. Even that is stressful, and that's part of caregiving, being there and being reliable all the time. So caregiving is a spectrum. It can be direct caregiving, it can be supervision, it can be coordination, it can even be just being reliable.
And caregivers need to think about all the tasks that they do. And you have to think about how does that interfere with the other things that I need to take care of in my life. Maybe you're working full-time or even just part-time, having to do that, having a schedule, and maybe you're still raising your family, raising your kids, so you've got those activities you need to keep up with, all your own household tasks, your laundry, your medications, your grocery store visits. So you've got to keep in mind that there are a lot of things that you're doing. So, given all of that, how can you handle all of that and still feel like you're taking care of and helping your loved one? What can you do?
Delegate. Now, that doesn't mean that you have to delegate the interaction, the loving portion of what you're doing, but there are things that if you aren't doing them, your loved one doesn't realize that as long as it's getting done. So, buying the groceries, and maybe you would deliver them or be there when the delivery service comes so you can help put them away. But your loved one doesn't care if you actually go to the grocery store and buy those groceries.
That's exactly right. That's exactly right. And very often families have difficulty coordinating assistance. And sometimes you may be the only family member available in the same city as your loved one. Other family members may be spread out, or they may have other things that interfere with their ability to help out with care. So it's not so easy to say, well, I'll just get my brother to take her to the doctor next Thursday. Well, your brother may have his own doctor's appointment next Thursday. And so it takes a lot of planning, it takes a lot of coordination, it takes a lot of thinking ahead for other people. And there is an element of caregiver service that a lot of people don't think about, and they're called geriatric care managers.
And, even if you're only coordinating information and doctor's visits, I have certain patients whose family lives out of town, and one child lives in town who always brings them to the doctor. This child wants to go on vacation, so brother or sister comes in to help with those doctor visits and so forth. Well, the brother and sister don't know the history, don't know what has been going on in the few weeks since we've seen each other last. They're just a warm body. So the primary child in town really is in this coordination position that's exhausting, and a care management team can help do that.
I call a geriatric care manager a surrogate daughter,
Right.
or maybe surrogate wife or husband, and depending on the relationship that the caregiver has to the person with dementia. Because when you think about it, the family member is the one who does all that coordination. But what if you had someone who could coordinate things for you, not take over everything that you're doing for your loved one, because you enjoy doing things for them, but to take over some of those tasks that might be interfering with other aspects of your life or causing you more stress. As Dr. Leatherman said, if you're on call 24/7 in case anything happens, it would be nice, wouldn't it, to know that someone else is on call for a while to let you relax, knowing that your loved one is going to have someone there and available if they need it, and you can take care of some things in your own life rather than worry about, I can't spend too much time at the grocery store because I got to get over to Mom's. I got to check and make sure that she got her pills in the mail and then put them in the pill organizer. And I only have 5 minutes to stay here at the grocery store because then I've got to go do that. And I've got to pick this person up. And
all right, I'm exhausted.
Ah!
So think about it. Are you a caregiver? Are you taking over a care management position that somebody else might better fill? Work with support groups. Think of some creative ways that you can take some of the responsibility off. And we'll see you next time. Thanks. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.